members. The next speaker, Dr. Stephen Krieger, actually developed his interest in MS at the age of 6 when he first participated in an MS readathon. Later on, after he brought his Ivy League pedigree through Columbia University undergraduate school and Yale University School of Medicine, he landed at Mount Sinai where like Dr. Fabian, he completed a neurology residency and then joined the Corinne Goldsmith Dickinson Center for MS as an MS fellow. He too received a clinical trials Sylvia Lowry fellowship from the National MS Society. And after completing his 2 years of fellowship, he stayed on as an attending neurologist in the center. Dr. Krieger has, in addition to his passion for taking care of people with MS, has a passion for neurological education, and he spends about half of his time directing the neurology residency at Mount Sinai. He's been given numerous awards as a neurological educator and is already widely sought out as a speaker. Michelle told you that knowledge is power, but unfortunately, information doesn't always equate to knowledge. And there's a lot of misinformation about multiple sclerosis that's available, particularly in that two-edged sword known as the internet. And Dr. Krieger, in his talk, is going to talk about MS Mythbusters and clarify some of the potentially misinformation that's out there about MS. Stephen?
So thank you very much for the introduction and for having me, and I want to personally thank all of you folks for coming out today. We really didn't know if we would be speaking to an empty house, given everything New York has been through, and so I think nothing speaks louder about everyone's resilience in the face of adversity than the crowd of all of you that are here today, so I appreciate that. I would also add to what Aaron said, I did an MS readathon when I was 6, which was, of course, a National MS Society New York City chapter readathon when I was 6, which sort of paved the way for me to contribute through academic things. I wasn't much of a bike-a-thon kid, I guess, but I was a readathon kid. So, as Dr. Miller said, my talk is called MS Mythbusters, and my goal here is to talk to all of you a little bit about data and information about this condition, how we think about it, and how we can think about it well to try and be as knowledgeable and as skeptical as we can be. MS is a condition that lends itself to myths. It lends itself to misinformation. Why is that? Well, I think I don't have to tell you, MS can be a very frightening diagnosis, obviously. And it's a diagnosis that is fraught with a great deal of uncertainty. And with that uncertainty comes fear, and with that comes the searching for answers that I think is extremely important, but I think it's extremely important to search well. So there are a lot of unknowns about multiple sclerosis. And there are unknowns when doctors and nurses are in the rooms with our patients. We don't always communicate perfectly, and we can't because we don't know everything. And so there are always going to be things that we don't communicate fully about, and that lends itself to myths and uncertainty. Our understanding of this condition is evolving, and that's a great thing. And so a lot of the things that you're going to hear about today, that you heard from Dr. Fabian, that you'll hear from Dr. Kasache, that you'll hear from Dr. Miller and Dr. Lublin about research in the future in MS, all presupposes the fact that we're still learning about this condition and we're figuring things out that we didn't know 5 years ago and that we didn't know 10 years ago. But what that means is what's true about MS today is not the same as what was true 10 years ago. And it's not the same as what will be true in 10 more years when we know more than we know now. That evolving understanding gives rise to myths and misunderstandings about the condition because the truth is changing, and we're working on changing it. But it's important that you stay up to date in what you know, because what you knew 5 years ago might not be true now. MS, as all of you know, is extremely variable and different from one person to another. So what is true for one of you may be completely untrue for someone else. That leads to myths and misunderstandings about this condition as well. And MS, as many of you know, is often a relapsing disease. It happens with attacks and remissions, oftentimes. Anything that behaves that way, with bad days and good days, with bad weeks and good weeks, or bad months and good months, gives rise to a sense of causality. What caused that month to be a good month? What caused a different month to be a bad one? And it sets people up to think that they understand what caused certain things to happen, when maybe that causality is not true. This is what we mean when we talk about things that are correlated, but not necessarily causative. Things might go together, but one might not cause the other, and it's sometimes quite difficult to figure that out. Myths about MS are extremely persistent, and some of the things I'm going to talk about today have been floating around in the literature and on the internet for decades. There's the fear of the unknown, and there's what I refer to as real hope versus false hope. I think hope is extremely important for all of us, on the patient side and on the care providing side, because it's what keeps us going. But hope can be grounded in real data and real knowledge and real things that are actionable, that we can do something about, versus hope that's based on a house of cards, hope that's based on something that's not going to hold up in the long run. And I think it's really important to base all of your hopes on the best possible information that will support them. So this is an important factor when thinking about myths about MS. And there is, of course, the allure of the anecdote. Every one of you has had somebody call you up and say, I heard something, and you have to know it because it's going to make all the difference in the world. And it's very, very tantalizing. And we, as physicians and scientists, we are not immune from this either. For us, we call it the case report. We see something that's really interesting, and we write it up and get it published, but it's still a case. It's still one person or one thing. And one person or one thing doesn't speak nearly as loud as the science that can answer questions that are meaningful for many of us, or for all of us. And that's going to be very important. It's easy to start a myth, and it's really hard to stop one. I've thought about this over the years, because I've given this talk in a variety of ways over the last few years, and I can talk all I want about how things aren't true, but that doesn't make them go away. And so I think what I've tried to do in this talk is talk about a few myths, but more importantly, talk about this thinking, the thinking that goes into understanding if some data is good and useful, or if it's not as good and not as useful, because I can't make any of these myths go away. But I can empower people to understand how to separate myth from fact. And that's what I'm going to try and do here today. The internet is extremely powerful, and it has been for a long time. It is an amazing resource, and it has great benefits of facilitating our getting access to information all the time and from anywhere. But the problem is it can propagate all sorts of bad information to the world in a way that wasn't possible a generation ago. Anyone can say they're an expert online and not be one. And so you have to be doubly skeptical about everything that you read, because you're not really sure of the source. And that's a theme that's going to come up a couple of times. One thing I tell my patients often is, if you see something that sounds too good to be true, it is, and someone's trying to sell you something. If you see something that sounds just worse than anything you ever heard before, if it sounds catastrophic, it is rare. It is rare and unusual, and is, for all the world, not likely to apply to you. All right? The media, and the internet is just one part of the media, is biased towards dramatic stories, for better and for worse. Nobody who has a boring day posts that story on the internet. Actually, that's not true. Now with Facebook, I've got to revise this whole idea. Everybody posts boring things all the time, but they don't get a lot of attention, right? The things that are dramatic are the things that get attention, and so you need to be mindful of that that things are not either as good or as bad as they seem. So my goal with this talk is really to address some myths head-on, but just a few of them, just a sampler, really, to show you how we try and fight misinformation with good data, while at the same time being humble and accepting that we don't know everything yet, and we are still learning. I would like you and for all of us to approach things with an open mind, but also healthy skepticism. Question everything. That's my theme of this Mythbusters talk. We're going to name some names. That is, we're going to talk about valid work, because they should get their due. And the goal here is really not to be exhaustive about myths, but to give you a framework, an approach, a way of thinking about things that you'll hear today and every day and in the future, so that you can help bust myths on your own. Now, before I go on, I have one disclaimer, and that is the following. Last year, at this talk, someone was very, very, I don't know, touched by one of the things that I talked about. So I'll say this. Some of the things I'll talk about may be controversial. You may have some strongly held convictions about some of the things I'm going to say. I will be here all day, and I'll be happy to talk to you folks individually about your strongly held convictions after the talk, but let's do it after the talk. That's my only request. Okay, here's the first myth. This is the myth that got me started in this talk and in this way of thinking, and that myth is that MS is caused by artificial sweeteners like aspartame or NutraSweet. So here's an email that was sent to me a few years ago. It's a lot of words, so I'm going to read it in highlights aloud here. This email went around the world millions of times. In October of 2005, it says, my sister started getting very sick. She had stomach spasms, she was having a hard time getting around, walking was difficult. By March of 2006, she was on 24 medicines. Doctors couldn't figure out what was wrong with her. She was in tons of pain. She thought she was dying. In March, I called her to see how her tests went. They said they didn't find anything on the tests, but they thought she had MS. That, of course, should raise some red flags right there, right? I recalled an article that a friend had emailed me, and I asked my sister if she drank diet soda. She said she did, and she was going to crack one open right then. I told her not to open it. Stop drinking the diet soda. I sent her the article, which a lawyer had sent. That's another red flag. Why are we taking medical advice from lawyers? My sister called me within 32 hours after the phone conversation and said she stopped drinking soda, she could walk, her muscle spasms went away, she was going to her doctor. In a nutshell, she was being poisoned by the aspartame in the soda, dying a slow and miserable death, and now she's on the road to recovery. So in many cases, those diagnosed with MS, most of the symptoms disappear. This is also true with tinnitus and fibromyalgia and lupus and ADHD and Gulf War syndrome. Aspartame, this email claims, is to blame. Stevia, which is a sweet herb, is not manufactured. It helps in the metabolism of sugar. The FDA doesn't want you to know about it because they're in cahoots with chemical companies that make NutraSweet. Okay, that's the story. I've edited it a little bit for length. So this myth has gone around. It sounds silly. People laugh. I laughed. But the thing is, this went around the world millions of times. Enough so that some of our MS patient education and advocacy groups needed to respond to this. So the MS Foundation said, the claims are, of course, not documented. There's no evidence for epidemics of MS, lupus, and these other diseases. There's no evidence that any of the authors have any scientific or medical or academic credentials. There's not been any research to support these claims, and there's no peer-reviewed scientific research that exists to attribute multiple sclerosis with aspartame or NutraSweet. I'll go one step further than that. MS is a well-known disease now, but it's not a new disease. MS has been understood and diagnosed and recognized for over 100 years, back to the days of a neurologist named Charcot in the late 19th century, who described this in meticulous, beautiful detail, the diagnosis of multiple sclerosis. The disease far predates our modern world and all of the additives and modern things to which we have added to our world. So the disease can't possibly be caused by NutraSweet because it was around long before NutraSweet was. Now, when I traced this email back, because that was the interesting thing to me, and you know how when someone forwards you an email, it's got headings and then more headings and then more headings, and you can trace it all the way back. When I went back, I looked at it, and this email was just bashing aspartame, but it was actually trying to promote stevia or stevia, which has now become a real thing, but this is a few years ago. There were other companies that were trying to promote stevia at the time using these tactics. And the person who originally sent this email, when you trace it all the way back, was a telemarketing email spam company of the sort that are hired by companies to try and do fear marketing. So this is a very, very insidious thing in our modern world, that there's often second messages layered into what we get that are trying to convince us to behave a certain way. And even though this was trying to scare people, at the end of the day, this was trying to sell them something. And I think that's important to know. So the myth, MS is caused by artificial sweeteners, and the fact is that neither MS nor lupus nor Gulf War syndrome is caused by artificial sweeteners, and this is an example of people trying to sell you a false belief. I'm turning to myth number 2. MS is caused by something called CCSVI, and that treating CCSVI will help MS. Now, for interest's sake, I have a question. A show of hands. How many of you have not heard of CCSVI? Never heard of it? Man, I feel like I should skip this part, because if you haven't heard of it, I don't want you to hear about it now. But anyway, I'll press on. A brief summary of CCSVI. Some researchers think that stenosis, or narrowing of the jugular and azygous veins, which are veins that drain blood out of the head and neck, may cause MS or contribute to the progression of MS by stopping blood flow from the brain and spinal cord. This has been called CCSVI, which stands for chronic cerebrospinal venous insufficiency. So there is no clear diagnostic evidence that CCSVI exists, and that it is in and of itself a clinical disorder, and that it is linked to multiple sclerosis. These constrictions of veins that are seen on these imaging tests may very well be normal variants that all of us in this room may have equal risk of having. And the safety and the efficacy of trying to open up these veins using the same sort of procedures that are done for heart attacks and strokes, where they thread in a balloon or a stent and try and pop open the blood vessel, the safety of that has not been fully established. Why is CCSVI even in this talk on myths? The original studies that were done that suggested this idea were not blinded. And a blinded study means the following. The person doing the investigation needs to not know what he thinks the answer is going to be when he's doing it. He needs to be blinded, he or she needs to be blinded, that is not aware of whether the person that they're studying has a condition or doesn't have a condition, because otherwise their preconceived ideas, their biases, will inform their results. So this notion of blinded studies is very important, and it just means that the researcher can't see the outcome that they're looking at before they do it. So when CCSVI was purportedly discovered, it was not done in a scientifically valid way, and it was done in a very small number of people. The problem was that the media latched on to this, and so there became an enormous amount of awareness of it, and the folks who did the original work lacked something that I think is extremely important. They lacked humility. They lacked uncertainty. They were sure that what they'd found was the answer, and they sold it to the world that way. And that, to me, was the real huge flaw of this, because we don't start with answers in science. We start with questions. We work towards answers. And here was a case of the cart being put before the horse. So a lot of effort and money has been put into trying to study this in a more valid way over the last 3 or 4 years. I'll tell you, 3 years ago, I was manning the MS Society's desk at the MS Walk, the sort of ask the doctor desk, and they told me that they thought there might be a riot because of this, that people were going to storm the table asking questions. Thankfully, that didn't happen because, I'm not sure that me and my other co-doctors were really ready to stop a riot ourselves, but we did answer some questions on it. But questions have really been answered over the last couple of years because some good studies have been done. And I'm just going to show you one of them, and I'm going to put up data so you can see the kind of data that we look at. So this was a study that was done with a lot of people, 35 centers, 1,800 patients, looking at folks with MS, looking at healthy patients, and looking at people with other neurologic diseases to see if this vein narrowing was actually more common in MS. If you look at the original work suggested that it was 100% accurate. So that's a pretty high standard to try and achieve. So here's what it looked like. When this data was done with 1,800 people, they did it in two ways. They did it with a blinded evaluator and then an evaluator who knew what they were looking for. And what you see here on the right are a couple of graphs. The blinded evaluator, I put blinded in quotes because it just means that they didn't know which patients had MS and which ones had other diseases and which ones were healthy. They didn't find this CCSVI in anybody. It was just incredibly uncommon across the board. So that's important. The second thing I want to show you is that bottom graph. The people who read those studies locally, there with the patient, the folks with MS seem to have more of the CCSVI than people with other neurologic diseases. But so did the healthy controls. So even there was no meaningful difference between folks with MS and healthy people in terms of CCSVI. So there's two messages here. One is, in a very large, well-performed blinded study by an important investigator, it wasn't there. And it shows you the importance of blinded evaluation, because if you're blinded to the answer, you don't have your biases inform what you're looking at. So I think this is a very important study. This was just presented this year, and it is one of the things that is allowing us to understand that CCSVI is myth, and it's hype instead of fact. So there is no evidence today that treating these venous occlusions will impact the course of multiple sclerosis or meaningfully improve quality of life. If it were harmless, it would be a different story, but it isn't. So these procedures, opening up blood vessels in the neck and head, have been associated with some serious and even fatal consequences, as you might imagine. This is not a benign procedure. People have had the stents that are put in migrate into other places in their head. They have had strokes, they've had bleeding, and there are people who have died from this. So, the fact is, the FDA finally announced a formal statement on this year. They have not cleared or approved any of these blood vessel opening angioplasty or stents for the treatment of CCSVI, and the use of these is considered off-label and experimental. And so probably the strongest thing I'm going to say in this whole talk is this bottom line. Don't get taken for a ride. Anyone who's trying to do this is trying to sell you something, and don't be a guinea pig. Don't let anybody experiment on you unless it's a real study. And the folks who greeted you and checked you in here, those are our research team. That's our research coordinators. Anyone who's doing a study has a meaningful difference between what is research and what is the care they're providing. If it's a real study, there are people who do the study. It is approved by what's called the Institutional Review Board. There are consent forms for it. You have to know that what you're doing is experimental. Okay, so that's our statement and my statement on CCSVI. I'll move to another myth, a slightly less controversial one. The next myth is that low-dose naltrexone is an approved treatment for multiple sclerosis. So naltrexone has been used for years to treat things like opioid overdoses, like morphine and heroin. It blocks certain receptors that are involved in the way those drugs work. And folks with MS have used low-dose naltrexone, or LDN, to treat MS after hearing reports that it might slow progression of the disease. LDN is not an approved marketed drug. It is made through pharmacies that compound it together. They mix together medicines to make the dosage that is ordered. The problem with compounding pharmacies is there's very little consistency to what they're putting together, and there's no guarantee that it's not going to interact with your other medicines and then it's not going to cause more problems. And we have seen that in the news a lot this year, not about LDN, but about compounding pharmacies in general with this recent meningitis scare that came from compounding pharmacies putting together medicines in a way that they shouldn't have, in a way that wasn't regulated, didn't have proper oversight, and wasn't safe. So this is one of the reasons that doctors are concerned about compounding pharmacies, not LDN specifically, but the whole notion that you're getting something from a source that is not being properly regulated. So there has been one good study done with LDN. This was 80 people, 80 subjects that were enrolled, 60 finished it, which is sort of a low rate from our perspective. They looked at the safety and tolerability of LDN and found that LDN was well tolerated and it was safe, but it did not work in terms of improving physical symptoms, improving disability, preventing relapses. It did seem to help with a subset of the mental health scores on one of these tests that they did, so there was a suggestion there that maybe there's a quality of life benefit, but it was a negative study. And more research could be useful here, but it's important to know that when something gets suggested, it has to be validated by studies for us to really start using it in a meaningful, data-driven way. So the fact is, there's no evidence yet that low-dose naltrexone is an effective treatment for MS. As an adjunct treatment, as an additional medicine for symptom management, maybe it could be beneficial in some patients, but more data would be needed to prove it. All right, I'm going to turn to diet, which is a whole category of myths about MS, and I'm just going to say a couple of things about it. I have a quote here from Dr. Miller, who talks about the fact that even though there are a lot of fad diets that are out there, and you can find books on these and articles and websites, none of those have ever been subjected to meaningful study. And so they are fads. They're suggestions, but unlike the American Heart Association diet, for which there's real data to tell us what that diet does for heart disease, there is no data to tell us what these diets do for multiple sclerosis. And so a well-balanced and generally healthy diet is what we advocate, but we don't advocate adding or taking away particular things from one's diet for the purposes of MS. I have a couple of caveats. One of them is, what about the swank diet? The swank diet has had a lot of press over the years. How many of you folks have heard of the swank diet? Good. So the swank diet was actually generated by a gentleman named Dr. Swank, who designed this diet and did a little study between 1948 and 1952. So it was a while ago. There were 144 people that he studied. And basically what they did, before the study, the fat intake of these folks had been around 125 grams a day. And 70 of these patients adhered strictly to a very, very low-fat diet, an extremely restrictive fat diet. These were called the good dieters. And the other 74 people were the poor dieters, didn't follow that plan and consumed more than 20 grams of fat a day. So unlike most studies, which are done for a particular period of time, and they have planned outcomes, and we look at what the outcomes were, in this project, they just let these people do this over the long term. And over the next 34 years, there were 23 deaths in the good dieters, and 58 deaths in the poor dieters. The surviving good and poor dieters were followed around 15 years later. So there was no real follow-up in between to see how these folks were doing, and there were no controls to this, and there were no ways of assuring the quality of the data. But they found that, because the folks who dieted well had more longevity than the folks who didn't, they concluded that, in all probability, MS is caused by the consumption of fat. This is a problematic conclusion in the way we think about science. It mixes up cause and effect. Right? They weren't looking at what causes MS. They didn't have a control group. This study was not designed to even answer that question. They didn't follow these patients for 15 years. So it's very hard to know what all else was going on with them that could have contributed to longevity. For instance, if a doctor told me, eat no fat at all for the next 20 years, and I'll see you in 15 years, I am not necessarily likely to adhere to that very, very well, and I think it doesn't take into effect confounders. So all the other things that could have happened to these poor dieters, like heart disease, cholesterol, body weight, level of activity, family history, adherence to other medicines, weren't taken into account. The other thing I would point out is that this study was done in 1948, and MS has changed a lot since that era, and our way of diagnosing, managing, treating, and caring for people is a world of different now than it was 60 years ago. So it's not even clear, even if this had been well done, could we really apply this data to all of you in 2012? So the short answer is we don't advocate the swank diet. We don't advocate these very restrictive diets because there's not great data for it. And so cutting things out of the diet is not something that we generally recommend across the board. Neither particular supplements nor particular restrictions meaningfully impact the course of MS in a way that we know. A healthy diet is advised on the principles of general medical and cardiovascular well-being. So, what about vitamin D? That's the exception, right? That's the one that's been really on our minds. And so this is my last one, because vitamin D illustrates a lot of important principles, I think, in how we think. So what about vitamin D? The background here was touched on by Dr. Fabian. There is a geographic distribution of multiple sclerosis. Regions with high sunlight exposure across the equator, which is the principal inducer of vitamin D, have low prevalence of MS. Folks that are born and grow up further from the equator, for instance, in northern Europe and northern Canada, have a much higher incidence of multiple sclerosis. So that's intriguing from a vitamin D perspective. Studies have found that low levels of vitamin D in the circulation are in fact associated with a higher incidence of MS, that MS is more common in folks who have low vitamin D. So then we look at animal models and find that in animals, and you're going to see some of the animal model type data later from Dr. Casaccia, in animal models we find that vitamin D does meaningfully interact with the immune system. And evidence from these studies suggests that vitamin D might help to mediate exactly the sort of shift in our immune system from pro-inflammatory to more quiet anti-inflammatory, exactly the type of shift that we're trying to do with our medicines. So what kind of data do we have in people? So when looking at endogenous vitamin D levels, just the levels that somebody has in their system, a new finding from last year was that for every 10 nanograms per milliliter increase of vitamin D, that's the measure that's used for vitamin D levels, for every increase of 10, there was a reduction in the risk for new MS lesions on MRI, and that was statistically significant. How about giving vitamin D? So supplemental vitamin D was shown that if you give more vitamin D to patients, they have a decreased number of new MRI lesions at 1 year. So that helps to suggest that not only having more vitamin D, but taking more vitamin D might reduce the risk for MS lesions. But it didn't show any difference on relapse rates, MS attacks. So that's more important to us, right? So in a larger study of 110 people, and this was just shown this past year, this was 118 people that are being treated with one of the MS medicines, natalizumab, so they were all on the same medicine, so that evens that out. Vitamin D levels were tested during the winter months, so it evens out the time of year that it's being looked at, because vitamin D levels change over the course of the year. Relapses were looked back at, and they found that patients who had lower vitamin D, less than 20, had a much higher risk of relapses than the patients with higher vitamin D. Now, if this were one of our clinical trials, we would be very happy with that result. That's a good-looking result at reducing relapse rates. And so in my mind, this is the most compelling data to date that higher levels of vitamin D are actually protective in multiple sclerosis. What are some of the downsides? Because everything that is good has risks to it. So the major side effect of giving a lot of vitamin D is having too much in the system and having high levels of calcium flow into the system called hypercalcemia. This can damage bones and teeth and the kidney. So this is America, so we kind of believe that if some of something is good, a lot of something must be really good. As it turns out, more is not always better, and one has to use a little bit of moderation, even with something like a vitamin. But this is the evolution, I say, from fiction to fact. The idea that something could be helpful being proven over time with good science. So there is now real evidence to do a placebo-controlled trial of vitamin D in folks with MS, and I'm happy to tell you that that trial is ongoing. So that is good, and that's going to give us the best quality data in a couple of years when they're done. This is not glamorous, but as opposed to CCSVI, this is an example of a small idea, and the closer you look at it, you realize the more that's there. Whereas with CCSVI, it was a big idea, and the closer you look at it, the more it seems to disappear. So the fact about vitamin D does seem to modulate the immune system. There's good suggestive evidence that it might protect against MS disease, and we have been recommending supplementation with doses around 2,000 units a day, which is likely to be safe and may very well prove to be helpful. So that's the current state of vitamin D. I'm going to end with a slide or two of take-home messages, as we used to say in med school, some things that you can take with you to think about other myths and other ideas that you might encounter. This is derived from the MS Society. This is a yes-no red flag checklist for when you hear about something that purports to be good for MS. If any of these things are true, you should be very skeptical. Does the thing you're hearing about suggest that that the thing is a cure? Does it purport to be a cure? Does the materials that you're looking at or that you read about suggest that what you're doing for yourself through your doctor's care or your nurse's care is harmful? Does it try and undermine what you think about your current treatment? Does the treatment in question supposedly help a long list of diseases like that aspartame email suggesting Gulf War syndrome and ADHD and MS are all in the same bucket? Is someone trying to sell you something? This can sometimes be hard to figure out, and so I ask you to think about that every time. Who stands to benefit if I believe what I'm reading right now? Because somebody does. Do you need to pay somebody? Do you need to pay somebody in advance for the thing that they're selling you? Is the treatment only available from one or a couple of rare sources? Would you have to travel to get it? Would you only be able to go to a particular clinic which is offering this thing? All of those things are red flags. And then think about how you heard about it. And so exert caution when it comes to things like direct mail and internet marketing. Any of those things is a red flag. So questions that you could ask. If someone tells you about something you could do for your MS, think about it. What does this treatment involve? How does it work? And why is it supposed to work? What's the data? How effective is it? How was that shown? These are questions that you can ask, and you can ask the person who's telling you, and they ought to be able to answer it. That's the thing for us. We can answer these questions about any medicine that we're going to offer, and that's important to be able to answer it. What are the risks of the thing that you're reading about or hearing about? Nothing is without risk. Even vitamin D at high levels has risks to it. So nothing is 100% safe. And then also, how much does this thing cost? What is it going to cost you? I think that's a really important thing to consider. We are all trying to learn how to be fiscally responsible with medicine, and I think that we all have to partner in that and think about what the costs of these treatments are. So get reliable answers. Get answers from your neurologist, from your nurse practitioner, from your center. Get answers from the National Multiple Sclerosis Society. Get answers from credible places. Thank you so much for listening. Thank you for coming today. I'll talk to you later.